Dennis Hartlieb, and I'm here to demonstrate Composite's tip of the month related to posterior direct composites. I've used Composite's Cosmic Core buildup material for tooth number 3 for the core buildup. But today's discussion is going to center around using direct resin composites to restore these Class 2 restorations. The key to developing ideal Class 2 composites is to first transition your Class 2s into Class 1 composites. After sectional matrices are placed and wedges are placed, we're using the total etch system, we're using phosphoric acid, and then following with Composite Complete 5th generation adhesive. The adhesive is light cured for 20 seconds. Now we're going to start out with the mesial-most restoration, and we're going to start with Composite's D-Mark hybrid flowable composite. The D-Mark is placed at the cervical box in a thin layer, and an explorer is used to bring the composite onto the matrix band. An instrument is utilized to support the matrix band while the D-Mark is light cured. Composite's nanocomposite is then injected into the distal box, and the excess is removed, creating a wall that runs from buccal to lingual, from cervical to the occlusal, to create a 1 millimeter wall to transition the Class 2 into a Class 1. This proximal wall is light cured, and then the matrix is removed and the wedge is repositioned to apply adequate pressure. Now the second restoration, the D-Mark is placed, and with pressure with an instrument, that is also light cured. Composite's nanocomposite again is injected to fill that mesial box, and a wall is created, forming the mesial wall. That matrix band is then removed. Then we go to the distal. Again, the D-Mark is placed along the cervical box, light cured with support with an instrument, and then the Composite nanocomposite injected to support that distal wall from buccal to lingual, from cervical to occlusal, about 1 millimeter thick, to create the entire wall. At this point, we have transitioned our Class 2 composites into 2 Class 1 composites. So we're going to inject now the nanocomposite to support the buccal cusp and the lingual cusp in increments, and each increment is cured for 10 seconds. Following those buccal and lingual increments, then we're going to actually use an incisal translucent nanocomposite, which will allow our composite to have more depth and create a restoration that has more natural characteristics. It is important to use eccentric syringes to inject the composite to be certain that you're not leaving any voids between the tooth structure and the composite. Each layer is cured for 10 seconds. The excess is removed, creating ideal tooth form and contour. Following the buildup of the composite, the nanocomposite restoration, some tinting is done using a number 1 brush from Composite, where many of the bristles have been cut off, using the light brown, the dark brown tints, and the white opaquer to create natural aesthetic effects for these posterior restorations. Following application of the tints, the restorations are cured for a final 60 seconds. After curing, we're using a Brasseler burr, the 8392-016, to adjust the proximal contours. A series of carbide and steel burrs are used for final anatomy contouring and for polishing. Composite's Flexi Disc is used to heighten the contour at the marginal ridge, and then a groovy brush from Clinician's Choice is used to apply the final polish.